answering your coronavirus questions. And I know you have a lot of them. We have been reading all of them. We're turning to the experts to give you just the facts and not spread fear. You can send us your questions anytime. All you have to do is text, not call, the number on your screen. That number is 503-226-5111. You know, we've received so many questions about the governor's stay-home order over the last 24 hours. Let's bring in KGW investigator Kyle Eboshi now. Kyle and I used to share an office before all of this social distancing. Now almost everyone at KGW. Seems like forever ago, doesn't it, Kyle?
It does. It does.
You know, Kyle, there's been so much confusion about the governor's order. You know, what have you been hearing from businesses in Oregon?
Well, it's just that. It's confusion. I've heard from many business owners and managers today via email, also on the phone, not quite sure what to do. They saw the governor's order. There's nothing clear or specific about their particular occupation or industry. And so they wonder, well, can I send my workers to a job site? Do I need to keep them in? A landscaper is a prime example, reached out to me and said, listen, I looked at the governor's order. I don't see landscapers specifically identified on that list, so I don't know what to do. Together, we were able to kind of walk through it, look at the order, interpret it, and that's exactly what a lot of bosses are doing, is trying to interpret this to see if indeed their workers can go to work.
So then you multiply that by so many businesses. So many people have to have questions. So who do I call, or who does someone call if their workplace is violating Governor Brown's stay-home order?
Right. And the key elements of that is, one, the social distancing. So the 6 feet away. If your business is still operational, which many are, one of the key components of that is you've got to have that 6-foot social distance between coworkers, right? That's part of it. Also, telecommuting is an important part of it. And also, if you're a restaurant, it's got to be takeout only. So if there's any type of violation of that and you notice it, you're asked to call Oregon OSHA. Oregon OSHA is basically the agency that oversees worker safety in the state of Oregon. So call them. Additionally, you can call Portland Police, the non-emergency line. But we need to be clear to people as far as expectations go. Police are not going to show up with lights and sirens blaring. They're going to take down your information and respond accordingly. So don't expect an immediate response from either agency. But again, the state is asking folks, if you see something or you feel uncomfortable in your workplace, you can notify these agencies.
Great. And while you were talking there, we had the OSHA website up on the screen and the phone number on the screen. So hopefully people can write those down. Now, does the order identify specific types of businesses?
It does. It identifies some of them. So, for instance, businesses that need to be shut down. And those are cases where there is close contact and there's really nothing you can do about it. Barbershops, for example, gyms, those must close down. Additionally, it identifies some other items that will stay open. So grocery stores, pharmacies, those are really important. One important distinction, and this is kind of what's leading to some of the confusion, we're seeing what's happening in other states, and other states are clearly defining these as essential and non-essential. And we're seeing these long lists coming from other states. And in Oregon, that's not really the case. They've given a few examples, again, of those that can remain open, and those with limitations that can remain open, including that 6 feet of distance, and those that need to be closing down.
Right. So Washington has its own list, correct?
Right. So that's a prime example of what we're seeing in other states, the essential versus the non-essential. Washington, Governor Jay Inslee released this huge document, 14-page, really specific details about job title and description that should be exempt, that are allowed to go back, that are truly essential. And so people are kind of using that as a guide to say, okay, I'm on that list, I can go back to work, or my employees can go back to work. The challenge is we're not seeing that dynamic in Oregon, and so people are looking for that list and it's just not there. A prime example, taxi cabs, right? Taxi cabs are essential. In Washington, they're clearly identified by name. It says taxi cabs are essential. They're allowed to be working right now. They're important. In Oregon, they're not specifically identified in that order. And so they're like everybody else, kind of saying, where do we fit in all this? After interpreting the order, they realize, yes, it's okay for them to be working. But that's an example where they may appear on a list in Washington State, but not in Oregon specifically.
So, Kyle, why doesn't Oregon have a comprehensive list?
Well, according to the governor's staff, and I asked that very question today, they looked at what's happening in other states. And their concern was, listen, if we create this huge list of essential or non-essential, there's a lot of change there. And if we end up changing that list on the fly, it could create confusion and really kind of slow things down. They didn't want to do that. So they wanted to try and be as basic and clear as they could, again, with a very simple list of those that cannot operate because there's such close contact, and those that truly can, no matter what, pharmacy, grocery stores, etc., and then provide general guidelines so business can continue operating in the state of Oregon with those basic restrictions. If you are going to be operating, there needs to be 6 feet of separation between employees or also customers, so that 6 feet of social distance we've been hearing so much about. Employees need to be telecommuting with possible. That's one of the other requirements. Or again, if they're a bar or restaurant serving food, it needs to be takeout only. They don't want people sitting down.
All right, last question before we let you go here. Does the governor does she think this is working?
She's really kind of taking a wait and see approach. We asked that of her today, and she said, well, let's kind of evaluate. Let's see how things look basically in a week. See if there is widespread non-compliance, because that's an issue. If people aren't following these guidelines, if they aren't following the orders, then she's going to be far more restrictive, she suggested. And that would mean basically more stores, more businesses would be required to shut down. But at this time, they just want to sit back and kind of see how things play out.
All right, great. Kyle, thank you so much, for answering all these questions. And I know you'll be answering more, in the days to come.
You bet.
All right, with the stay-at-home order for Oregon issued, you can still get outside for recreation, but you have to keep your distance. I asked Dr. Kavita Patel, a contributor with NBC News, for some advice and responsible ways to get out of the house. So you lived here in Oregon, you know all of the options that we have here. I mean, just so many places to hike and, see beautiful sights. So you think that's safe, that's okay to do?
It is. Now, remember, we know that something where people are handling surfaces, I'm just thinking of windsurfing, and if you're sharing, a paddle on a paddle boat, anything where a person who's sick and then has contact with a surface could be a mechanism of transmission. So again, I would make sure that you are thinking always, washing your hands if you're using something that's shared amongst other people, or try to minimize that. So your 2 legs and just breathing your own oxygen outside is really the best thing to do. And certainly the beauty of Oregon offers a lot of that.
Right, while staying away from other people. Now up next, taking a closer look at your heart health and the coronavirus, what a leading cardiologist says is most important to keep in mind while staying home. We've heard people with heart problems are more at risk for COVID-19. I talked to a leading heart doctor here in Portland last week about why that is and what all of us should be doing to protect ourselves. Joining us now is Dr. Beckerman, a cardiologist for Providence. And first, doctor, thank you so much for joining us.
My pleasure.
I wanted to ask why certain people are at higher risk of having serious symptoms if they could get COVID-19.
Sure. If you want to think about your health almost like walking on a balance beam, some of us are younger, have fewer health problems, and our balance beam is wider. And those of us who are older and have other health concerns like being immunocompromised or having a lung problem or a heart problem, that balance beam is narrower. That doesn't mean that you can't walk on it, but it means that if the wind blows, you're more likely to fall off.
Okay.
And so when you think about COVID-19, it's sort of like a wind blowing. It's a challenge to your body in every way. And so if you're starting from a place where you might be a little bit more sensitive to those types of challenges, you can certainly get into trouble. And that's why it's so important to heed everybody's advice regarding staying at home and staying healthy.
It's a great analogy. And what should those higher risk people do right now to protect themselves?
They should be doing what all of us should be doing, which is to stay home, to continue to the extent that you can with the healthiest lifestyle possible that you can. And that means continuing to exercise, whether you have the ability to do that at home or to get outside a little bit. Make sure that you're taking your medications if you have prescriptions, and make sure that you don't run out. And eat healthy. None of us are really eating at restaurants anymore, so this is the opportunity to try to go through all those heart-healthy recipes that we've been asking you to do for so long.
And is there anything else besides, eating healthy? Is there anything else that we should be doing during this time to keep our hearts healthy?
Well, I think that the lifestyle advice that people like me have been telling people for years, it's really consistent. It's about maintaining some level of activity, trying to eat healthy and not using this as an opportunity to gorge ourselves on less healthy foods. Try to remain connected to one another, even though we can't necessarily do that in person, trying to do it, whether it's on the phone or through FaceTime or text or social media. So I think that the more that we stay as a community, even as we manage this in our own way, sometimes on our own, will be the better for it.
All right, Dr. Beckerman, great advice. Thank you so much.
Thank you.
Let's answer some viewer questions now. So this viewer wants to know, for those cases that have recovered from COVID-19, how long did it take them to recover? According to doctors, for mild cases, the time from infection to recovery is around 2 weeks, but it can be up to 6 weeks in more serious cases. Some people have gotten better, but then they became very ill around 10 days in. Our next viewer wants to know what happens when the curve finally goes flat. How long do we have to worry about COVID-19 hanging around? They ask, will there always be a chance someone could get sick? Could this happen again? According to our doctors, the short answer is we have no idea. We don't even know how spring and summer will affect it. We may or may not have to live with this virus from now on. A doctor said, yes, this could happen again and again. And our last viewer question for this segment, we are washing our hands, but I noticed that all the antibacterial soap is gone from all the stores. Yet COVID-19 is a virus. Is regular soap effective against coronavirus, or do I have to use antibacterial soap? That's from Patty. Health experts say you don't need to use antibacterial soap. Regular soap is just fine. Just make sure you're washing your hands for at least 20 seconds and you're washing your hands often. Please keep sending in those questions. We will do our best to answer them every night. You know, one thing coronavirus has put into focus how essential the grocery store is for so many people. I talked to Dr. Payal Kohli about the safest way, to do your shopping. I also asked her some of your other common questions, from how effective are homemade masks to what medication people should take if they get coronavirus.
Groceries is an important point, because when you bring home your groceries from the store, you want to be sure not just to pop them in the fridge and to put the plastic bags right on your counter in the kitchen, because the bag could potentially be contaminated. And if somebody who has the virus handled your groceries, potentially the groceries themselves could be contaminated. So you really want to be mindful, again, that on plastic it can last for up to 3 days. So either leave the bags in the garage or throw them out, or wipe them down if you're going to bring them inside your home. And similarly with the groceries, before you consume anything, make sure you wash it with running water and some dish soap in the sink really well.
That's a great idea, to keep the bags in the garage. I didn't think of that.
Yeah, that's what I've been doing.
So, okay, let's talk about masks. With the shortage of N95 masks, there are people trying to make homemade ones to donate to hospital workers. Is that a good idea?
So this frightens me, actually, because the virus, as far as we know, is transmitted by respiratory droplets, and N95 is really the only safest way to protect against the virus. Now, the CDC has said that if you're in a pinch and you don't get N95 masks, you can use surgical masks. But now we're getting into an era where we have shortage of surgical masks, so people are actually using homemade masks, such as the one you're talking about, or the CDC says you can use a bandana or a scarf around your face. Now, we know that those don't offer adequate protection against this kind of a virus. So I think the only role that I see for those types of masks is really to put on top of an N95 respirator, so that you can reuse that N95 respirator between patients. Because one of the reasons that we're running short is because the protocol says to dispose of it in between patients, because the external surface of the respirator could be contaminated. But if you're wearing a respirator with another covering on top of it, and then you could dispose of that additional covering, it might be safer to use the respirator in that way. But homemade masks are definitely by themselves not adequate protection against this virus.
And we've taken calls from people who think they have coronavirus and they cannot get tested. Is there any medication, over-the-counter medication, they can take to help symptoms, and any medication that they should avoid?
Yeah, so the testing is a frustration even for us in the healthcare system, and there are a couple of companies working on home tests that people can take themselves at home, so stay tuned. But there are some medications. If you have a mild case of symptoms, you need to assume that you have the virus, because the statistical probability is that you probably do. Isolate yourself from your friends and family members, do all of the things that we've talked about if somebody has a suspected virus, and then treat your symptoms with over-the-counter medications. Now, there's some question about ibuprofen and its safety in treating COVID. In Europe, they're saying no ibuprofen, but here in the United States, they're a little bit more divided on whether or not it's a problem. I would say ibuprofen has more side effects on the kidneys, on your blood pressure and such. So probably safer to start with Tylenol. You can use over-the-counter cold medicines to treat your symptoms. And the time to seek medical care is if your symptoms are getting worse. If you develop shortness of breath, that's a big one. So I'm going to say it again. If you get shortness of breath, you need to call your doctor right away. Or if you're in a high-risk category, you're one of those vulnerable populations.
The question about the onset of fever and your ability to transmit the virus. We know that less than half of the patients that ultimately become infected with coronaviruses lack fever at the early stages of their infection. So you can be shedding virus and not be febrile. Over the course of the illness, nearly 90% of those that become infected have a fever. So later on, a fever is a much better indicator of disease.
We are getting a lot of questions about the stay-at-home order. So Valerie wants to know, I am curious whether having family members who live outside the home are permitted to visit elderly parents during the shelter-at-home order. So listen, the entire point of the stay-at-home order is to stay at home. Doctors say you should not be going around elderly relatives. That said, the order does not specifically say you cannot go to a family member's home. Now, when it comes to visiting assisted living facilities, the Oregon DHS did limit all visitation at those facilities to essential medical personnel and emergency personnel. You can only visit residents there who are in end-of-life care. All right, our next question, the person says, I work at a construction company. Is my industry considered an essential business and exempt from certain stay-at-home order provisions? That question is from Jeff S. So according to the governor, if you cannot work 6 feet apart and maintain social distancing and you cannot telework, you should not be working. The governor said that business should close. Governor Brown said they may come out with additional specifics on what jobs are essential versus not essential if they hear that people are not complying. Please keep sending your questions to us. We will do our very best to answer them during our special show every night at 7 o'clock. And thank you so much for joining us tonight. Go to our website, kgw.com/facts-not-fear. You can look at all of our past stories and all of the questions we've already answered. Please keep sending them in. We read all of them. We know you have a lot, so do we. We will do our very best to answer them every night at 7.